Hello, everyone. This is Ward Bryson coming to you out of Health Ed at the Athens City County Health Department. It is February when we are recording this, which means it is Heart Health Month. And recognizing that, we will be doing a podcast miniseries focused on heart health. Today, I am joined by Logan Lambert, a Comm Corps member stationed at Nelsonville, York City Schools. Logan will be joining me most of these as our sound tech and perhaps getting behind the mic a little bit. And our guest today is Bailey Plumley with Athens City Schools.
Hello. Thank you for having me.
Yeah, how are you, Bailey?
I'm doing really well. I'm enjoying the fact that it's no longer 0 degrees outside and most of the snow is melting away. So it's shaping up to be a nicer February than it seemed like it was maybe going to be there for a while.
I am also very glad for that. Do you know what we're talking about today, Bailey?
I understand that we're perhaps talking about personal experiences with heart health.
Yes, so we are going to talk a little bit just about personal experiences, our experiences with family. This will be kind of an informal opening episode to our series. We'll also talk a little bit about stigma, I think. Wherever we end up is fine, so don't feel too constrained.
Perfect.
So
sounds good.
What is your experience with heart health and heart disease in your family?
Well, I guess personal experiences in me directly. I'm fortunate in that I have not had any issues with my own heart. However, I did grow up in a family that has had a few pretty obvious examples of people that had issues with heart health. And I know even maybe some other issues beyond the obvious. The obvious I'm referring to is that my mother had open heart surgery when she was a baby. The doctors were aware when she was born, basically, that she had a heart defect. And I actually did a little bit of prep to ask specifically what it was. She had a ventricular septal defect, or VSD, which is a hole between the ventricles, which are the bottom two chambers of the heart. There are several other hole defects that are more serious or require a more urgent response. But hers was something that they prepared for, and then she had surgery when she was about 1 year old, I think. And so I grew up knowing that about my mom. Even as a child, before I fully grasped it, I was aware, of course, that my mom had a scar on her chest, which when I was very little, I actually believed was how I was born. Which is kind of sweet and poetic. Actually, someone pointed that out to me, that coming out of her heart, kind of sweet that way.
Was that because there was a lack of communication about that specific scar between you and your mother, or was that something you invented despite having been told all the facts about that specific?
It was probably just the way kids can sort of learn information and not connect the right dots.
Okay, that makes sense.
I think I knew that my mom had something wrong with her heart when she was born, and I was aware that she had a surgery for it. But the dots were not connected. I was also not aware of how babies were born, so so it's kind of oh, maybe that's how. And so she, fortunately though, has never had any real issues with her heart since then. She has a Teflon patch in her heart that was put in during that surgery, and she was 1 year old, and it's been there ever since. Okay. She does regularly see a cardiologist every few years to just basically check on it. And I know that there are other precedents, I think, for heart disease in my family. I think my grandmother takes something for her heart. What was really interesting, though, is that I grew up, having a mother who had open heart surgery. And then for a period of time, my brother dated a girl who also had a heart defect that required open heart surgery. Although in her case, she had multiple open heart surgeries, including well into her teenage years. And there was a really bizarre twist where we found out a while into my brother's relationship with her that that she and my mother shared a cardiologist. Like the same doctor that like saw my mother as a baby was the doctor that saw my brother's girlfriend at the time as a baby for the same heart issues.
Well, was all of this centered around Bucyrus, Ohio?
No, actually, it was more just Ohio in general. So it was not that centralized because Bucyrus, Ohio has no resources like that. So you'd have to leave Bucyrus to get something like that. Yeah, I guess that's probably the shortest version of the most obvious instances of or examples in my life of issues with heart health. And I suppose as a result of that, I probably grew up maybe a little more conscious of it just because there were these literal sort of like visual indications of it that would lead to conversations. My great-grandmother famously had like as many stents as you can fit in a heart. like she needed more, but the doctors were like, there's no room. Like we cannot fit anything else in the heart to hold it open. Like, I'm not in other families, so I don't know what it's like, but.
No, I yes. You're here to speak to your own experience.
Yes.
You don't have to come in and be an expert. I think it is curious though that your mother had that defect from birth and like the possibility of complications thereafter, because a lot of people think of heart health and heart disease as things to be concerned about when you're older.
Yeah, definitely.
And that's not the case. Not that you shouldn't be concerned about them when you're older. And not that there's a greater risk as you age or just increased presence of risk factors as you age. But people can encounter heart disease at any age.
Completely.
And especially something like that, like a birth defect. A lot of people are born with things that impact their heart health. It's just a whole wide world of things that people don't consider and we don't talk about, really.
Correct. Yeah, that's very true. And that's definitely something that's probably contributed to like a more like overarching awareness or pursuit of awareness on my part in terms of health. Especially understanding the things that can contribute to your heart health or lack thereof. And the way we're sort of like our bodies and our minds are one holistic thing. I was thinking in this case specifically of mental health. I mean, I also have grown up aware either within the family or family friends or the people I've known of people that have like encountered heart issues because of like chronic stress or other issues that are not necessarily fully within the control of the person, but are something that you do have the power to find a way to treat or remedy. And so I guess the kind of the combination of that awareness plus, possible like proclivities or the dispositions genetically in the family. I suppose I'm probably a little more conscious of it than some people would be just by default.
Yeah, you definitely seem to have a higher level of consciousness, which I find interesting because I don't think I was very conscious at all about heart health growing up. And even now, like I'm in some kind of quasi state of like knowing some things and understanding some things. But like even like doing research for this podcast, I ran into a lot of new information. But like talking about stress contributing to it or anxiety and those things contributing to it or overwork, I think is important. So
yes,
for the listeners, my background, my mom also dealt with a lot of heart disease. She had a stroke, I want to say, maybe like 2012 or something like that. And then in 2018, she went into heart surgery for an arrhythmia, and she actually did not survive that surgery. But I would say her issues were stemming very much from stress, overwork, and there was a stigma about not talking about it,
Yes.
or just keeping on with life and working and going to work and those sort of things and putting off treatment.
Yes.
I feel like that's a big stigma when you look at like heart health and heart disease with
Completely.
people, especially like middle-aged, over-the-hill people who are of older generations.
Yeah. Well, I think it's one of those things where I think that might be an effect of the stigma of there's some level of stigma attached to a lot of health-related matters, but I think that's an area where we really feel the effects of the stigma surrounding mental health, because obviously we know that your mental health and your physical health are completely linked, and but one of them I would argue is maybe a little more stigmatized than the other, and so what you run into is people who are maybe experiencing physical ailments due to their mental health, but are sort of unwilling to treat or acknowledge them because of the mental health connection. Like if they were to happen in a vacuum or like in a purely physical sense with no real cause, it sometimes feels like it would almost be more acceptable to like seek help and to discuss doing that than when it's because of like chronic stress or like untreated anxiety, or because this is bringing to mind specifically again in my family, particularly in my mother's family, there is a lot of heart issues. Like I said, my great grandmother had survived heart attacks, had a lot of operations done to her heart. In the wake of those, my grandmother, her daughter, I know has been on some kind of medication for sort of heart rhythm issues for a long time. And then, of course, her daughter's my own mother, who I've already talked about at some length. But, like, when you have an issue like some kind of irregular rhythm in your heart or something that you're already medicated for, it becomes particularly concerning during those times of stress. Like, my grandmother recently lost her husband, my grandfather. And so, like, she's been under a lot of stress. And certainly at the time when he was sort of ailing, I'm certain she was just completely like fraught with anxiety and distress. And I remember it being a conversation, within the family, that when someone like that is in a situation where they're not able to sleep well, they're running around like crazy, handling all these things, sort of in a position where there's a lot on their plate, there's sort of an extra level of concern, because it's like, oh, well, they're a very essential part of the body is perhaps compromised compared to the average person. But there is this sensation, particularly with certain people, that it's sort of something that you don't take up with them, or that like you don't bring it up to them.
So there was a conversation within the family, but she was not included.
I don't know if that's true. I'm not saying that that's necessarily the case with my grandma specifically. I think that the conversation may have taken place. I don't know, but I was present for conversations where we were just sort of expressing, that sort of genuine, loving, familial concern, where it's like, she's going through a lot right now, just like we all are. But like, there's this extra concern, which I think says a lot about the way this sort of full picture of our health is maybe sometimes neglected or needs to be taken into account. It's not always, we can't always treat every person's situation as the same. Being in a highly stressful situation is one thing for someone who has a completely healthy heart, but it's another thing for someone who doesn't.
Yes. And I do think it's hard for both people that are experiencing that personally, like that is their immediate issue, and then people around them to talk and like express things about that honestly and openly, because like you said, there is kind of a stigma around those things. And I do think it ties into that mental illness versus physical ailment concept, but also it really is an issue of visibility and invisibility.
Yes.
Like if you have a heart arrhythmia and it's harder for you to do certain things or to like go about your life the way you would normally. To some people that might look like laziness, or that might not look like you're trying as hard if they don't know the full story.
Yeah.
And I think people are afraid of being perceived as less than, or as less than capable than they once were,
Yes.
And even though that is a physical ailment, because it's invisible and it's not as easily apparent as like they have a broken leg or something.
Yeah, it's like they it's not like they're gonna carry around a sign or like a shirt that says I have a heart arrhythmia. Like, so it's definitely one of those things that sort of reminds you to be more like graceful and compassionate and patient with people, particularly people you don't know much about, because you don't know much about them. You have no idea what could be going on inside their bodies or their brains.
Yeah, and that is the thing with pretty much all heart disease, is that it comes in an invisible way to people on the outside. And even to the people experiencing it, it can be hard to diagnose at an early stage if you're really not looking out for a lot of the signs. So, I don't know. I just feel like that stigma and the lack of education about it is really what sets back a lot of people's health outcomes, and prevents them from seeking treatment for their issues.
Absolutely. It's also, so much of health inevitably ties into sort of larger social issues, because I'm not sure if stigma is the right word, but you know, your heart health is something that's affected greatly by diet, for example. And you know, when it comes to diet, there's a lot of socioeconomic factors that determine what you're able to eat. And so one thing that does come to mind is the sort of judgment or sort of like condescension that you can encounter in communities that are sort of a lower socioeconomic standing, and you know, only have access to cheaper foods and more readily available foods, which in this country at the moment, you know, generally amounts to the things that are more processed, you know, more fatty, more rich with like sugars and things that might contribute to poor heart health. And so you run into this sort of ugly thing sometimes when you're sort of, when we see these, you know, PSAs or campaigns, or even like the sort of medical world speaking directly to people, is like, you eating these things, drinking these things is bad for your heart, and yet these are the things that some people are used to eating or drinking, or the only things they have available to eat or drink. And so it kind of becomes a good example of the way, like, you know, certain types of health can be a privilege, heart health included.
For sure. And that doesn't even touch on the ideas of which foods are culturally significant to certain people, and which foods, they talk about access, and it's not just cost, which is what some of our listeners may think, but it's also just literal access. Like, how, is that available to you? For a lot of Athens County, they live in a food desert.
Exactly.
And their nearest food is at like the gas station or the little Go Market down the street, and they can't really have access to fresh produce or to whole foods, and there's just a lot more processed foods. And lower value foods that they have access to, and those things are cheaper. But also, if that thing is 15 miles closer to you, then
absolutely, that's what you're gonna have.
We can save that conversation for a later episode. But there's definitely a lot of layers to heart disease in our country and in our community, and it's hard to pinpoint, you know, what exactly is causing each individual comorbidity for a lot of those things.
Is it still the leading cause of death?
It is still the leading cause of death.
Okay. I know there have been some shifts in.
You asked that like it was some kind of like statistic.
Well, no,
it
is, but I just mean, I know that I feel like I always am seeing shifts in those statistics. It's like, oh, this is now the second leading cause of death. So I was just curious if it is still the leading cause of death.
Yeah, and I don't think there's any signs of that changing anytime soon.
Yeah. What exactly constitutes heart disease? Like, is that a umbrella term, or? Yeah,
so like things that we've talked about, like heart arrhythmias and like your mother's condition with a hole in the heart, and like those are very like physical and things like that, but also like high cholesterol and like just things that increase your risk of stroke or heart attack. Comorbidities can all fit under that umbrella of what we term heart disease, or things that contribute to heart disease. So that is why kind of the focus of this will be, you know, fitness, diet, medical perspective on what people should be doing to take care of their heart health and maintain their heart health. But some things are unavoidable, like we talked about. So there are layers.
Mm-hmm.
Yeah.
COVID and heart disease then. So I imagine that a lot of the things you just described, sort of issues affecting the heart, I imagine most of those, and some of them I've specifically heard, are things that make someone more susceptible to serious illness or death from COVID.
Yes. Yeah. Any risk of heart disease, and there's a whole list of other unrelated conditions too, make someone at a higher risk to serious illness or death from COVID. COVID is not to be messed with in any stretch of the word, but yes, heart disease is for sure something that contributes to that. As is obesity or a sedentary lifestyle, any smoking history, mental health issues make you a high risk for COVID. So, to our listeners out there, this is our obligatory warning. We are recording in the times of COVID, so please be safe, take COVID seriously, get tested, and please get vaccinated. Yeah.
All of that.
All of that. No, but for sure, and not just COVID, but any illness. These things complicate diagnosis. They complicate when you're actually experiencing an illness or an ailment. And I think that helps to contribute to why heart disease is the leading cause of death in America, is just because it's such a fundamental part of the body, and it's such a fundamental thing to have impaired when navigating the world.
Yeah, it's like the heart, the lungs, and the brain. It seems like if anything's wrong with those three, generally the rest of the body is going to be struggling.
Yeah. So I think the big takeaways from our conversation today. I will be wrapping up now. Thank you for coming to talk to me, Bailey. But
Thank you for having me.
Yeah, of course. Some big takeaways. Just one, stigma around heart disease and all kinds of heart disease. It's important to talk to your loved ones about what they're experiencing. It's important to keep an eye on symptoms of any heart disease, to keep an eye on your behaviors, to stay active, and to try and eat as well as you can. And again, people at different levels of access. In terms of stigma, though, like, heart disease can affect anyone.
Completely.
It can affect someone from birth, or it can affect someone like through adolescence. It's not just a disease that older people get. Likewise, even if an ailment is quote unquote invisible, it does not mean that it's not there, and it does not mean that someone who is
or that it's less serious.
Or that it's less serious.
That there's also that thinking that that the most severe things people can be facing are really obvious, and if they're less obvious, then it means they're less severe. That's not how it works.
Yes, not how it works at all. So if there's any indication that someone is experiencing poor heart health or indicators of heart disease, they should take that seriously, and they should seek help where they can.
Mm-hmm.
It's not helpful to just muddle through. It's not helpful not to talk to people. And this is a serious issue that affects a lot of people and leads to a lot of deaths and harm every year. Now, on perhaps a brighter note, we will be following this episode up with some features on physical activity in our region, as well as probably diet, and hopefully a look at a more official medical perspective on heart disease and how to avoid or how to live with it. Thank you again, Bailey, for joining me today. Thank you. Oh, sorry.
I was just going to say, my pleasure.
And thank you, Logan, for being our sound tech. Logan is nodding in the background. We may get him on mic yet. I promise that.
I think you should. The people deserve to hear what he has to say.
And the people. Thank you for listening, everyone. We hope to see you again soon.